effective CPT with you, and how this came about is sometimes when patients come in, they want CPT, because a lot of our patients do the vest at home. We probably have 25 adults that have IPVs at home, so if they're doing that all the time and they're still having an exacerbation that puts them in the hospital, we want CPT to be an option for them. And it is physically intense, but I want to show you just a technique that I've kind of learned over the years to where the patient gets involved with the therapy too, to make it less intense on the therapist. Because like I said down in our meeting, you can beat on someone for hours, and if they're not going to help you cough that mucus up, it's all in vain, And this also came about from, I had a 16-year-old patient once, and she told me she fell asleep with her vest on every night. That's how she slept. And I thought, was it really doing what we want it to do? You shake that mucus up, but the patient has to cough it up. So, after doing this for years and just, doing the CPT, kind of worrying about what segments to do, what position to put a patient in, the CF Foundation's made it a little easier for us because they don't really recommend head down position anymore. Especially in patients under 10 years old, it's not recommended at all. 99% of CF patients are on medication for reflux. So reflux is a huge issue, and by putting the head down, we can exacerbate that problem. So we can drain these areas by having Rob contribute and do some breathing techniques as I'm beating on him. Now when I say that, I want to say that it doesn't mean that you can never do head down. Some patients will want it. And that's kind of what I'm going to go through when I do the disease of the month. It's just tailoring the treatment to the patient. And being on the CF team, I'm going to help with that. But sometimes patients are admitted on the weekends when we're not here. So just getting therapists comfortable with finding out, okay, you do the vest at home, and you're one of those patients that do it faithfully. Maybe we need to switch it up. So just kind of figuring out what therapy is going to work best is what we need to do. We had a patient who does the vest on his way to work every day, and when he comes in, he lives alone. He wants CPT because he just figured he wants that hands-on touch therapy, and he can't do that living alone. But when he comes into the hospital, he expects it from the RT. So if it ever comes up where you can't do it, if your back or your hands, just call the supervisor, and you can switch off with someone and get someone that will do it. But I'm going to teach an easy way. We're going to start on Rob's upper lobes here. And what we're going to do is I'm going to do the cupping and clapping on him, and he's going to take 3 breaths. He's going to kind of count the breaths out. On that 3rd breath, he's going to take a total inspiration to inspiratory reserve. He's going to hold it for about 3 seconds, and I'm going to increase the intensity, and he's going to do a forced expiratory technique or a huff on the way out. And we'll do 3 of those on each lobe. Okay? We're going to do the upper lobes, we'll do the 2 middle and the 2 lower. So we're going to go to six lung sections when we do this, okay? Alright, so we're going to get started. He's going to count this out. And this takes some concentration on both parts. So I really don't talk the whole time, except I'm going to today because I'm talking to all of you. Get one before we start.
That cup, please.
Yes?
Thank you.
So you kind of notice how I kept clapping through his coughing. So sometimes this therapy's, so productive sometimes with patients so I get a little break now. So now I'm going to my 2nd set of 3.